for records that show where the millions being spent on migrants is going.
Some records we did receive show employees working at migrant shelters have made more than $135 an hour. NBC5 investigates. Bennett Haverly is here more with what you've discovered, Bennett.
Yeah, Kate and Alex, imagine making almost $200 an hour. These invoices show it has happened at the privately run shelters housing migrants. Today.
Hello, family. Welcome back to another episode of Journey to Harmony. I'm your host, Richard Harmon. Today I want to talk to you guys about a story that broke, I believe, a week or two ago. And what happened was there was a nurse who was working in Chicago at the time, working with a lot of the migrants that were coming in to the city. This nurse, it's a pretty amazing amount. The nurse made $20,000 in 1 week of just working with these migrants. So what's happening right now, there's a serious shortage right now in nursing. In healthcare in general. What happened, many people, whether it's during the pandemic, prior to the pandemic, many people decided that it wasn't in their best interest anymore to work in these healthcare fields. And it's kind of a supply and demand issue that's going on right now. There are more people who are in need of healthcare. As people are coming across the border, they're going to need to get checked out. They're going to need to those who are going to be working, they're going to need to get physicals. They're going to need to get all of these things that is in addition to what's already being taken care of by our local hospital. So there's a huge influx of demand that's coming upon the system overall. And additionally, there's going to be a lack of people going in because of things like IT. I think IT has kind of given the option of a shorter window for a lot of people. And the idea of working from home and all these things seem so attractive to many as it should. I've spent the last 6 years working in IT, and I can tell you that for sure. It is a comfy opportunity if you find the right space. But if you're in the groove where you're needing to make some money, and you're looking for opportunity that isn't particularly long, but just something that you can do in the short period of time, maybe a year or 18 months, between LPNs and radiology technicians, there's a great opportunity and a great need for these particular people in this particular time frame.
Invoice shows a nurse earned more than $20,000 in 1 week. Those figures do account for overtime.
To see invoices like that are disgusting. They're outrageous, and they should be cause for an immediate investigation.
Do you have an accounting for all the dollars are going?
No, we haven't been. And I think that's the big concern that came up today was that we're willing to accept federal dollars. We're willing to give dollars to these issues, but we need to see where every penny is spent.
NBC5 investigates filed public records requests 3 months ago. So far, we've received just 2 invoices, contracts, and a spreadsheet showing since October, the city has spent at least $83 million on companies and organizations that provide care to the 13,000 migrants now in Chicago. Aldermen voted Thursday to accept another $33 million in federal money, but raised some concerns that it comes without knowing where the current dollars are being spent.
In terms of those who are looking for opportunity, what's getting ready to happen is we're either in a recession or heading into a recession, getting ready to be called in the next quarter or two. And what's going to happen once that happens, many companies are going to pull back in their hiring processes, pull back in their just overall support and load of employees. What we want to do during this time period, you want to be able to hold on to your salary, hold on to your income. So what you want, what is an opportunity for those who are interested would be healthcare. For entry level positions, you have things like CNA, certified nursing assistants. And these particular roles are going to pay roughly about, it depends on the area. You're looking at anywhere between $20 and $35 per hour, in basically many of the middle of the country areas. The need for these roles are growing. And if you're able to get outside of the city more times than not, you're looking at a much greater amount of money. I'm going to continue making videos such as this, just giving people updates on different roles and different opportunities that do present themselves. But again, during these times of downturn, those who get ahead generally are those who are able to maintain their status quo and status of living and be able to invest in some cheaper priced assets at that time. What are your thoughts? Please comment below. Like, share, and subscribe. Thank you so much for joining. Have a good day.